everybody. My name is Sana. I am a medical student at the University of Colorado, and I wanted to talk today about mental health first aid, which is just a way of talking about when people have mental health issues or feel like they're in crisis, and how we can help support them and how we can help see what's going on, and so we can know what's the best way to help and what's the best way to be supportive for them, especially if we're their friend. So the main reason I'm talking about this is because it's really common in young people in general to have something like depression or anxiety, and it's helpful to know what to do if things get really scary and we're worried about someone. And it's actually really common to deal with these things, especially when we're dealing with really difficult and stressful circumstances, like not having housing, not having money, or being mistreated. And basically, I wanted to be able to inform you guys so you have more power over how your life goes and don't feel overburdened by these things. So I just wanted to start with how to recognize the signs of these really important common things like depression and anxiety. So, for example, for depression, if you notice someone is really not enjoying the things they used to enjoy, or having a lot of low energy, kind of staying in bed all day, low motivation, it just kind of seems like they're down. Maybe they're not necessarily crying or anything, but it just seems like they're not having any sort of good feeling, and they're just kind of a flat mood or a low mood. So that can also come with like someone sleeping way too much or sleeping way too little, or their appetite changes, like they're not eating as much as they used to. So basically, what I have to say is that it can really help to just listen to them, to just bring it up and say, I've noticed that you've maybe changed, and I'm worried that you're going through a hard time. How have you been feeling lately? And it's also helpful to be respectful and listen to what they have to say. Sometimes what they say might not make sense because maybe they don't really understand how they're feeling, but you are doing a good thing by bringing it up and wanting to talk about it. And it's important to not blame them or say things that aren't really helpful, which sometimes it's our instinct to say these things, but it's just been shown that it's not helpful. So I'll tell you what's not helpful. It's difficult for someone who's feeling bad to hear that you think they should just snap out of it, or to dismiss what they're saying and be like, well, even though you feel bad, I don't really think you feel bad, or I don't see what you're seeing. And it's just important to really take them seriously, because they know themselves better than anyone. And the other helpful thing you can do is encourage them to seek help. Sometimes when we're young, we feel really a lot of pride, or we feel afraid of what's going to happen if we seek help. So it can be really helpful to reassure someone that you're by their side and what help looks like. So that's another thing I wanted to cover is, what does help look like? What is the treatment? What's going to happen if you tell someone, hey, I'm feeling down or I'm feeling depressed? So one of our main treatments that is the most effective of them all is just therapy. So just talking to someone who is trained in helping people feel better, helping people overcome the way their circumstances make them feel. And that's always our first go-to. So it doesn't necessarily mean the scary things like being in a hospital. And I know like movies and shows, they sometimes over dramatize it and make us feel really afraid of asking for help. But I can promise there's a lot of steps that are really simple and not as scary as we would expect. You know, it's not that you go straight to the hospital. People do go to the hospital when, you know, they're at risk of hurting themselves or hurting other people, or, you know, they're just not being safe for whatever reason. They're really in danger. But other than that, you know, standard depression or not feeling great is a perfect candidate for regular therapy, and it's really helpful. Um, so, the other thing that's really helpful if people are not ready to talk to someone is meditation, which, you know, has its perceptions, but it's really just something you do where you try to clear your mind and follow like a 5 minute thing on an app that kind of tells you to breathe in a certain order and picture certain really calm things, or um, think about what you're distressed about, what you're upset about, and how to reframe it so that you turn it into a sliver of positivity and hope in terms of like, oh, this is really common feeling. However, it turns out not you're not actually like the bad way you're thinking of yourself or something like that. So meditation really helps us take the way we're feeling and try and transform it into a more realistic way of looking at yourself and your potential and how you could feel better. And it's actually been shown that meditation can improve about 50% of the symptoms that we feel, which is more than like any medicine. If we give someone a heart medicine, it doesn't have that much of a high success rate. So it's really important and a big deal that meditation can do that much for someone. Um, Another way people get support is support groups. So if someone's really experiencing grief, like someone died or, you know, they're separated from their family, there are support groups for that where you just meet with others once a week or, you know, however often you want, and you get to talk and share with other people who are going through the same thing. Other support groups are like Alcoholics Anonymous, Narcotics Anonymous, and that's for people who might be using like pain pills or heroin and things like that. So that can really transform the way people feel and the way people can turn their life around and feel supported in doing that. Because it's a really hard thing to be using a substance a lot and feel like you can't let it go. But these groups really are successful at helping people get through that hard time with support. Another option is psychiatry, which is using medicines. So it's the same kind of process as finding a therapist to talk to, but it's someone who's a doctor who knows how to prescribe medicines, which is also a really common practice. Lots of people use medicines, and it's not the end of the world. Like any medicines, it can have side effects, but a lot of people also don't experience any side effects and just feel a lot better, and they go back to being able to function. So, those are the treatments that I think if you support a friend experiencing just feeling off or feeling upset all the time and depressed, you can reassure them that these are options for them to feel better. Because when people feel really depressed, one of the symptoms is just hopelessness. Like nothing could make this feel better, and I'm never gonna feel anything different. I'm never gonna accomplish anything, things like that. So it can really open their perspective. And again, it's easy to be on the outside and feel like they're being irrational, but ultimately that's just a symptom of their disease. So it's important to be understanding and listen and not blame them or be irritated that they're experiencing this, because it's just a part of how we're experiencing it. So that's depression. The other thing I wanted to cover is anxiety. Those are the two most common things, and it's anxiety kind of looks like a lot of fear and avoiding certain activities, like, oh, I don't want to go out. I feel too stressed about what's going to happen tomorrow. What's going to happen today? How's this going to go? And it also can look like trauma, like PTSD, which is post traumatic stress disorder. That's the one that is really common in the military after people see really scary, horrific things and they see a lot of violence. Basically, that looks like getting a lot of flashbacks and memories that are just kind of intrusive. We're not trying to think about those things, but they kind of just show up whenever they want, and they can really make us feel in the moment like we're back in that traumatic situation. So that's important to be able to recognize in someone, like they're not able to sleep really well because their thoughts and dreams keep making them really upset and scaring them and not letting them sleep. Um, so things like that are what I wanted to let you guys know about anxiety. That's a little simpler to recognize. But yeah, the last thing I wanted to talk about was suicide. If someone you know seems like they might hurt themselves, or they're doing small self-harm behaviors like cutting themselves and things like that, it cannot hurt to ask someone, hey, are you thinking of hurting yourself? I can promise you that's way more effective than being afraid, because a lot of times we feel like, oh, if we bring it up, they might go through with it. And that's a normal fear to feel, but from talking to people who have suicide and from research on how that goes, it's been shown that having that conversation does not like push people over the edge. It overwhelmingly helps them kind of confront how they're feeling and confide in someone and feel supported, like, oh, I'm actually allowed to say it out loud that I feel like there's no point in living anymore, or I feel really close to doing this. And it can just help really stop that process and help bring them out of those thoughts. Again, don't blame them. It's just how they feel. It's kind of part of the disease. Some of these symptoms are literally caused by a little too much of a certain hormone in the brain, and a little too less of a certain hormone, and it's really not in our control. As much as we'd love to think, oh, you can just change your thoughts, you can't. Um, Therapy can help you change your thoughts, but it's not helpful to tell someone, hey, just change them. Um, so with suicide, it's always helpful to ask someone, what are you thinking about doing? Are you thinking about hurting yourself or others? And then it's helpful to just really encourage them to seek professional help. But you're not wrong if you tell an adult about it either. You can always tell them, and it will help this person get treatment and break them out of the cycle of thinking that way. And they might not be happy about it in the moment, but it's a life-saving thing to tell someone who can help, and they actually get the help they want. It might be upsetting for them at the time that you went off and told someone a secret they told you about how bad they feel and how much they want to hurt themselves, but it's the right thing to do, and it's really effective. So that's all I wanted to cover. I know these are heavy topics, but I really think if I had been young and taught about these topics, I could have really helped other people I knew who were going through a really hard time, or myself. I think like I've been through times like this before, and my friends who knew about this type of stuff and how to recognize it were the ones who were able to help me. And there are plenty of people who don't know how to recognize these symptoms, and I kind of had to figure it out on my own, or I kind of just had to let it go on for a really long time before I just kind of was able to seek help on my own and figure it out that I need to ask someone. But there's no shame in it, and it's common, and you can always do something about it. So that's all I wanted to say. That's my take on mental health first aid, and I really hope it comes in handy for you guys. Thank you.